When military members are seen on the outside by civilian providers, I always recommend, first of all, that their symptoms be validated. TBI and PTSD have been the signature injuries of these Afghan and Iraq wars. And what's different about these is because of the improvements in armoring of the vehicles, body armor, what would have killed people in prior conflicts only injures them. And so if you're in the vicinity of an explosion, that blast wave that goes through you that you definitely feel, they'll use the term "my bell was rung," that can cause brain damage. And so while looking at the person, all their limbs are there, they don't look injured, you might say nothing's wrong. And that's often what happens when people get seen on the outside by folks who don't deal with this in a regular way. They'll say, well, I did an MRI of your brain, or I did an exam. I don't see anything wrong. Well, why don't I remember? Why don't I sleep? Why am I yelling at my kids? There's something behind that. So one of the focuses at the NICO is to do research and come up with ways of detecting in a more sensitive way what is wrong. And right now we use MRI with technology that's twice as detailed as a normal MRI. And we are finding things that couldn't be seen on other scans. So many of the guys come to us, they said, hey, I had a scan at a big medical center, here's the disc, it was read as normal, we read it, yeah, it's normal, and then on a higher resolution scan you see things wrong. What we usually see wrong are injuries deep in the brain to some of the tracts that would affect your mood and your memory and such. And some of the research we're working on now is actually to be able to detail to almost the axonal pathway, the fibers crisscrossing the billion fibers across your brain, to find breaks in those axons that's even better than MRI can find, and then to help to correlate that to the symptoms. Because right now, when we see things wrong in the MRI scans, we're not exactly sure what they mean. I have some guys with 100 little white spots on their brain that represent little scars, and yet they're still pretty functional. I have others who maybe have 2, and they say, I can't remember my wife's name. So someone who seems to be fairly impaired. So we don't yet have very consistent, objective testing to be able to say that your symptoms are valid, here's a picture to show you that. And so that's where the area of research is looking right now. And so again, because of there's areas that are unknown, this whole TBI thing really only came into prominence in the last 10 years. Obviously people have had injuries for decades and hundreds of years, but it was never to this level that we've had in the military. And so I at least try to, if I were to counsel a civilian provider, I'd say you have compassion, realize that, give validation to their symptoms, there's something there. And certainly the worry is, well, what if they're making it up, or they're embellishing, things like that? That's always a factor, but people don't usually want to go to the doctor anyway. So there's got to be something there you're probably going to find. Maybe they're adding a little bit to what's wrong, but usually I say there's still probably something there. They just want you to believe them and take them at face value. Usually if someone amplifies their story or uses pain scales that are maybe higher than they really are, it's because other providers they'd seen seemed to not believe them, or said it was in their head, or didn't treat them with respect. And so I think doing all those things as a provider, it will get you a more accurate presentation from the patient. They'll feel more comfortable telling you exactly what's going on in a real way, not amplify it.